So yeah, we can kind of tailor and kind of pick and choose as we go, since I know who's in the room. So I do want to tell you a little bit about who I am in case you're not familiar with what I do here. So like I said, I'm the Director of Student Placement and Partnership Development. I work mostly with the first-year master's students as they prepare for their DEP experiences, do the approvals and tracking and organization and partnership solicitation related to that. But I have seen some of you at the undergrad capstone, which I've participated in, and yeah, so I am excited to see kind of a diverse group of students here in terms of programs, and hope that this can contribute to discussion today. So just as a caveat, so if you were in the undergrad capstone, this is similar material, but again, since we just talked about talk a little bit about my own journey, not because the presentation is about me, but because there's a lot of different components, and I think it can illustrate what some of the pathways to public health careers can be like. So first of all, I'm from the great state of Minnesota. Any Midwesterners out there? Yeah, all right, Midwest. So have moved to a much more balmy climate these days. But I spent some time in some cold weather. Again, I went to Colby College, and I majored in psychology and Russian. Public health was not a major at my school, but I was really interested in health disparities. I didn't have that word, but so my public health journey kind of started back in undergrad. And post-undergrad, I did a fellowship in Russia and worked with children there in an orphanage and did some childhood development stuff. But then I came back to the States and was really passionate about working with LGBTQ communities because I was interested in the health disparities within that population. So first did AmeriCorps. I don't know if people are familiar with AmeriCorps in terms of services, years of service. But so then that really launched me into kind of learning about what the field of public health is and the lingo, the terminology. Went and took a break before my undergrad and went to Hawaii. That's why the little palm tree is there, and worked on a farm because I thought, well, I'm really interested in nutrition as well and food access. Realized after that, and a little bit of stint in nutrition when I moved to Philly, that was not the direction I wanted to go, and so landed here at Drexel, and I've studied my MPH here in community health and prevention, and then am continuing on in my PhD. So I show this again to show that there are fellowships, there are years of service that can land you into fields and a trajectory into public health. There are paid internships, which is what I did at the Food Trust. There's travel and experiences that I gained along the way. And then, of course, there's continued study at the graduate level. And also I show this to show that you don't have to be stuck in just one topic area, that it can be something that you can learn as you go and gain the skills that can be valuable to a public health career in the future. So the bottom line is that it's not just full-time forever, that you can work in fields for a part-time basis, a temporary basis. You can go back to school. If you're an undergrad now, you can go back for a master's. If you're in a master's, you can go back to a PhD if that's something that is in your trajectory. And so just to kind of highlight some of these that we've already talked about, there are travel or gap year activities some of you may be considering. Service work such as Peace Corps, AmeriCorps. A lot of these often provide a living stipend and valuable experience. Sometimes they have an educational voucher that you can use for future or past educational expenses, like loans and such. And then there are also fellowships. So, some of the common ones that people are familiar with are Fulbright, which are often international opportunities, or international exchanges where people from other countries come here as well. There are ASPPH fellowships, the Association for Schools and Programs of Public Health, as well as ones at the CDC, so these other external organizations that are public health focused, or the Association of Public Health Laboratories. Fellowships are often temporary, so sometimes students get worried about applying to those because they don't know what's going to happen after that 1 year or 2 year fellowship ends. But again, it's not just full-time forever for everyone, so like it could be an opportunity to get mentorship. They're often very prestigious opportunities, so to have something like a Fulbright fellowship on your resume or a CDC fellowship on your resume could be, something that is a step to a next opportunity at another institution or the same institution. There are paid internships, like the one I did at the Food Trust, so that was an opportunity to try something new in a field that I wasn't quite sure if I wanted to enter that. So if that's something you wanted to dabble in post-graduation, that's an opportunity as well. And of course, there is full-time or part-time work that could be on a more, with longevity, whether that's, a grant-funded position or a more, position that is not grant-funded that could be extended for a long period of time. So are people out there familiar with Peace Corps and AmeriCorps? I see some heads nodding. And so this isn't going to be, super in-depth. Of course, I encourage you to look at websites if you're interested in either of these, but just to provide a overview of what these two opportunities are. So AmeriCorps has 3 programs. It's the National Conservation Corps, State National, or VISTA. And so Conservation Corps is kind of maybe what you think of when you hear of conservation. So it's a lot of outdoor environmental conservation. VISTA is about capacity building in an organization. So it might be about volunteer recruitment and engagement. It might be fundraising, other type of capacity building activities. And State National kind of has a lot of different programs that relate to a variety of interests. And some of them are listed here. And so the Peace Corps is really an international opportunity, often 2 years, and then the sectors are listed there, but health is one of them. But many of those could relate to public health, like education, environment, agriculture, economic development, youth development. All of these can relate to public health, so don't feel like you're limited to just looking at the health Peace Corps opportunities. Are there any questions about years of service? All right, moving on. So I want to talk about fellowships. So these are these kind of more short-term, often 1 year or 2 year fellowship examples. And these are at the Post-Masters level. And these are, I'm happy to send slides at the end. Don't feel like you have to take pictures or copy them down unless you want to. So as you can see, like the first one listed is at Mainline Health. So that's a regional healthcare hospital system institution here near Philadelphia. And that's focused on those typically in hospital administration. So those are, again, usually 1 or 2 years, sometimes shorter, but definitely if you're interested, if you're in that health management policy track, might be of interest to you to kind of put on your radar, notice when the timelines are. Often fellowship deadlines are in the fall or winters to start in the summer. So kind of keep that in mind. Other ones, such as the Centers for Disease Control, many of you are familiar with the CDC, and they have aspirations to be involved in that organization at some point in your career. Fellowships are a great way to start to get to know the organization, know people there, and they have many opportunities in many different types of labs, whether it's environmental health, maternal child health, infectious disease, et cetera, et cetera. I'm not going to go through the list of them one by one, but again, they're ones that I encourage you to take a look at following this presentation. And similarly, these are some post-bachelors fellowship opportunities, and some of these may take both levels, so I encourage you to look at both slides, whether it's postmasters or post-bachelors. But these are ones that advertise themselves as taking on post-baccalaureate alumni. All right, so we're going to transition. That was kind of an overview of some of the other, not just full-time, forever kind of positions. And now I want to talk about transition and talk about the full-time job market. So overall, the Bureau of Labor Statistics in 2016 said that employment in the healthcare and social assistance sector is projected to add 4 million jobs by 2026. So about a third of all new jobs are going to be in those two kind of buckets. And it's going to become the largest major sector in 2026. So, or by 2026 at least. So, this is a great opportunity, a great time to be studying public health, to be entering these types of realms, whether it's healthcare, and that could mean a lot of different things. That could mean administration, that could mean research within a healthcare institution, that could mean direct care, if you're somebody who's interested in going into direct care, whether through future education, for example. And so, I just gave you one. But I want to pause and see what are the types of organizations that you know that public health grads, whether it's at whatever level, could be working in. So I gave you one. I said academic orgs. Others? Yeah?
Nonprofits.
Mm-hmm. Nonprofits? Where else are people hoping to work? Yeah? Government? Okay.
Federal government.
Government? Okay, so yeah, federal, but yeah, state, local as well. Yeah?
Pharmaceutical, like biotech.
Pharma and biotech. All right. Anything else we haven't gotten to yet? All right, so we get pharma, biotech, nonprofits or community-based organizations, and that could be within the U.S. or abroad. Actually, all of these could be within the U.S. or abroad, technically. Healthcare systems like hospitals and clinics, federal, state, and local government, insurance or managed care organizations, and then consulting firms. Healthcare consulting is something that I think people are seeking public health degrees, graduates, people trained in this field as well. So I'll flash back to that slide. But what sector do you think has the most grads? And again, some of you learned this in the undergrad capstone course, so. Which do you think has the most entering grads? Who votes for academic? Okay. Pharma, biotech, private industry, nonprofits. Okay, got a few more hands there. Healthcare systems. Okay, about like half the room maybe. Government. Insurance. Consulting. All right. So yeah, healthcare has about 23 of people graduating with public health degrees. About 23% of them are going into healthcare, followed by for-profit at 19%, academic institutions and government, and then nonprofit hovers around 10 to 12, and then this kind of self-employed, whether folks are starting their own nonprofits, becoming entrepreneurs in some other way, and then others, kind of that like mystery category. So since there are some undergrad folks in the room, I'm going to show both bachelor's and then master's level grad entree slides here. So this is from, again, ASPPH to all accredited schools and programs of public health. And so you can see where grads are going. Is the top category is actually unknown, followed by for-profit organization. So that unknown are people who don't fill out their grad surveys. So this is a plug for people to fill out their grad exit surveys. We love to know where people go, and so does ASPPH, our accrediting body. And it also helps folks like you to kind of see where people go after graduation. And so at the bachelor's level, it tends to be folks going into for-profits, healthcare, government, etc. And this breaks it down a little bit, and I'm not going to, spend too much time on these because you can have the slides at the end. And are they going to be posted on Dash? Gabby? Okay.
Yes.
Thank you. But here's the MPH, and there's two sides of this slide because the red is our institution. So this is Dornsife. Whereas we don't have a big enough sample size for the undergrad that they'll report to us. So hopefully in a few years we'll get there. But this is, after years of grads at the master's, the MPH level. So as you can see, more of our grads are going into for-profit compared to folks from other schools. So the gray is that other schools bucket. But then we do have a lot going into healthcare, academic institutions, and government. And fewer going into nonprofit. And that unknown, I like when the unknown is small because that means, again, people are communicating to us what they're doing. And this breaks it down a little more. So when you break it down by type of institution, hospital is actually close to the top, kind of very close to post-secondary institutions, like people either going on to future study, maybe PhD programs, or working in post-secondary institutions. And then this is for the MS, but I don't think there are any MS students in the room. So, but again, you'll have that information as well. And doctoral. All right. So we're gonna do an activity in a second. So my question as we do this is to kind of think about what sort of job titles relate to public health. I meet with a lot of students, or I hear from students in emails that say, I type in epidemiologist and I don't see a lot on LinkedIn or in Indeed or anything like that. And of course, epidemiology or epidemiologist is a popular title. And it is a title that epidemiology majors or maybe others may be able to find jobs in. But of course, there are many other things that public health students do. Is anyone finding, maybe who are looking for jobs or who have kind of explored around, finding other titles that have related to public health? Or just epidemiology? Yeah?
So there's this research coordinator thing.
Okay, yeah.
And also like environmental health specialist, health and safety specialist.
Right, yeah, those are some good ones. So research coordinator or clinical research coordinator, and then environmental specialist or health and safety specialist. Yeah. Any others that people are finding a lot or that they just learned about? All right, well, good. We have an activity that you can do. So, anyone ever looked at ONET? Okay. So ONET is maintained by the U.S. Department of Labor, and you can search for positions and see relevant tasks, the median wages, and both the technical and the soft skills. And so I'm going to get out of my presentation for a second. And I know this might be kind of small, but I want to show you. So for example, let's type in epidemiologist here at the top right-hand corner. So what it will show is that there are 9 occupations that are close to epidemiologist when I type that in. In case it's small in the back, some of these say social science research assistants, statistical assistants, geneticists, veterinarians, dietitians, preventative medicine physicians. So some of those you can see are much closer to, I think, what you might think of as an epidemiologist, like a statistical assistant or a social science researcher. Veterinarians, maybe not so much, but you can kind of see where that's going if they're studying zoonotic diseases. But just for sake of looking at this some more in detail, so for epidemiologists, it'll detail the type of tasks, and why this might be helpful is when you're putting together resumes or cover letters, you can kind of start to see what these main tasks would be, using appropriate buzzwords that may help further your application along. It lists technological skills and knowledge. It lists so many things. You can look at this on your own. But where I want to point out at the bottom is it lists education. So 60% of folks who are epidemiologists have master's degrees, compared to 23% who have doctoral degrees and 7% who have bachelor's degrees. So you can start to see as you're looking for certain roles, maybe, oh, this is the level of education I'm planning to have, in 18 months or in a year or in 3 years, whatever your plan of study is. And then at the very bottom, they'll show, again, some of the other related occupations that they showed before, as well as wages and employment trends. And of course, these are trends. These are things that vary by state and locality and all of those things. Various locations have different costs of living. So it's important to kind of keep that in mind, that if you're applying to an urban area versus a rural area versus, New York versus Wyoming, like there might be different costs of living. So that could make salaries different, but it's a helpful guide, I think. And again, you can click on the local to see the state wages. So I want to just do one other. So clinical research coordinator was suggested, as well as environmental. So let's type in mental health just to see what comes up. And so there are only 9 occupations that related to epidemiologists, but there are 20 that relate to environmental health, for example. So this kind of gives you a sense that there's more varied titles within something that relates to environmental health. Again, not all of them may have the training like a forester. Like, we don't tend to teach forestry in the MPH or in the bachelor's level, but some of them are more related to maybe your degree of study. So what I want you to do, I know a lot of you have phones or laptops. I want you to work with someone near you to kind of look through ONET and kind of pull out some job titles that may be relevant either to your plan of study, your major, your degree, or ones that you haven't thought of before. So I'll give you 5 minutes to do that. Did anybody find positions that they hadn't ever searched for or weren't familiar with in terms of using for their particular job search that they may have done in the past or currently? No new ones, we knew them all. So what were some of the common ones? Yeah?
I mean, I don't know. It was a climate change analyst.
Climate change analyst.
So like environmentalist is like...
Yeah, all right. So yeah, any other ones that were common or that you hadn't heard before? Yeah?
Clinical data manager.
Clinical data manager. All right, so yeah, I can certainly see that being very related to public health. Anything else? Yeah?
Community health worker.
Community health worker? Mm-hmm. All right, and so I went through and did some of this as well and pulled out some for both bachelor's level, master's level, and I think this can be a really helpful exercise to find other keyword searches to put into job search engines, whether it's LinkedIn, Indeed, all those kind of things, because if you're just typing in public health, I think a lot of people get frustrated not seeing, what they're looking for, or as many options as there could be. So some of the titles that I came up with going through the ONET website where it said a lot of people were bachelor's level. So there are case managers, and then you can kind of use these program, project, and research words with lots of other words. So it could be an assistant, an associate, a coordinator, an officer, a specialist, a manager. And you can actually kind of do that with data as well. It's not up here, but you could say data associate, data management assistant, data manager. So then there's outreach workers, programmer health educators, wellness specialists. A lot of people, wellness is a word that we use a lot in health, but a lot of people don't type that into a search engine. And then health navigators or community health workers. And some of them are redundant to this master's slide, but some of them are different. So again, we saw that epidemiologist tended to be more at a master's level, or statistical analyst, clinical research coordinators or associates. And you can see that manager kind of shows up a little bit more at the master's level. And then finally at the bottom, infection preventionist or infection prevention practitioner. Sometimes you need an RN, a nursing degree for those, but sometimes they are open to folks who don't have those type of degrees and have public health expertise. And this next slide is going to be very hard to read, but if you look at the slides themselves, you'll see those as well. So, are there any questions so far about either job titles, searching for the kind of terms you may want to use, or anything else so far? Cool. All right. So there are job search engines. Of course, there are other ways of finding a job that aren't on the internet, and we'll talk about those too, but many folks do access the internet to find jobs. And so there are ones that are public health specific, and there are ones that are more general. Are people familiar with the Public Health Employment Connection? That's the one run by Emory. I see some people shaking their heads, some people nodding. So I'll just show you what it looks like, just so you're familiar with the site. If you Google PHEC or Public Health Employment Connection, that does come up at the top, or at least it does for me. Let me see if I can zoom in. There we go. So this is, I think, a great resource, especially if you're not limited to a certain geographical location. You can sort by city, by country, by state, if you look over here on the right. But as you can see, there's lots of different opportunities. There are ones that are at all levels, including postdoctoral fellowships, if that's ever something that you want to go and do a doctoral degree and then do a fellowship afterwards. But I think many of these titles that we were just looking at on the previous slides show up. So data analyst, occupational health and safety specialist, researcher, and then there are ones that are very specific, like drug and alcohol program analyst. You may not put that in a search engine, but it comes up if you were to type in program analyst. So yeah, encourage you to check that out if you're on the job hunt. And then there's also Simplicity, which is operated by Dornsife, and it's not as robust in terms of so many of the others, but when our employer relations folks, our community partners, are looking for people, they often send them to us. And so they'll say, we've worked with Drexel grads in the past, we're really excited that we have an opportunity open. So it's not populated with many opportunities, but they're often ones that they're looking for Drexel grads because of our reputation of having great students. There's publichealthjobs.org. Again, similarly, if you're not specific to Philadelphia, it can be a good resource. And the Public Health Career Mart is run through APHA. You do not have to be a member of APHA, the American Public Health Association, to use Career Mart. And it tends to be skewed towards faculty positions, but there are other positions as well. And then I've listed on here many of the common job resources that people use, like Glassdoor, Indeed, Idealist, which tends to have jobs focused on social justice, nonprofits, that kind of thing. But they do have a range of opportunities, like folks who may work with data, folks who may work in policy, folks who may work with communities or environments. So yeah, but it tends to be focused on the nonprofit sector. And then, of course, there's LinkedIn, which I will talk about a little bit more as well. Any other sites that people use that they found helpful, that they want to share with the group? Or that they've used these and have struggled with? Any element that you think you could get support around? Nope. All right. Oh, and there's also Vault, this is the one at the bottom. So it's helpful for researching companies and other, it has a lot of other job search resources, but in and of itself, it doesn't have a lot of job opportunities per se. It has internships sometimes, but it's helpful for, again, it's similar to Glassdoor in that it has reviews of organizations and such, but if you're looking for that. So I showed you Public Health Employment Connection. This is Simplicity that many of you are familiar with. And this is Public Health Jobs, so I just have, so you're familiar with what the sites kind of look like. And so the final kind of section, I suppose, is how else might you learn about jobs? Are other people using other avenues or that they've heard who've been helpful? Any other strategies? Yeah.
I mean, like reaching out to your network or networks of people that you find that would support you.
Right, okay. So yeah, networking, reaching out to your network. Who are people in your network that you could utilize? So there's classmates, professors, there's other folks that you've known from previous jobs or other, school academic programs. And how many people have ever done an informational interview? So some people, okay. So I'm gonna this is information about informational interviews. And I think one great resource can be alumni of DSPH programs. And I'll show you a little bit about how you could find those people. So first of all, actually that's an old link, the linkedin.com/alumni. It just, it changed recently. But I'll show you where you can find it. But then you can also go to graduate advisors, professors who say, and you can say to them, I'm really interested in working in X, Y, and Z. Do you know if we've had recent grads who've been successful in finding jobs at those places? Do you think there would be anybody who may be interested in having me talk to them for a half hour about how they found their job, how they, what they didn't expect that they now are seeing in the job, what skills were helpful? And, of course, you don't want to go into an informational interview and say, hi, I'm looking for a job. Do you have one for me? But, be gracious and learn about their experience. And you never know that if you give a good first impression and they think they could be a good fit for the company that they're working for, they could refer you down the road. So this is something I definitely encourage folks do throughout the time in the program, not just when they begin to look for jobs. Because it's, again, you don't know when 3 months, 6 months, 12 months down the road, a job could potentially be referred to you. So there's also colleagues at your internships or co-ops, and so it's important to stay in touch with folks. I think it's always good practice to kind of reach out on a regular basis to old faculty that you had positive relationships with or old supervisors to say, hey, I'm finishing up my degree at Dornsife. This is what I've been learning, and this is what I'm hoping to do, and thank you so much for all the mentorship you've provided in the past. It really helped me do X, Y, and Z. It kind of keeps people being like, oh yeah, that former employee of mine is finishing that degree in public health now. I wonder what they're up to and how I can be supportive to them. And then there's professional association members, and then your connections. So this is LinkedIn's alumni feature. Some people I know in the room are familiar with it, and we showed it when we did the LinkedIn workshop back in the fall. But do want to point out and demonstrate it for people who haven't used it as or aren't as comfortable with it. So you can go to linkedin.com/school and put in whatever previous university you've been at, or Drexel University /people. And you can see that there are over 100,000 alumni who are using LinkedIn from Drexel. We can go in and go to alumni. And if we type in, you can sort by where people live, which is helpful if you want to stay in the Philadelphia area and find connections there. You could type in, oh, these are all the folks who work at Comcast. Or a public health relevant organization. But if you go to what they studied, you can add public health. And so you can see there are almost 1,000 public health student alumni. Of course, those are at multiple levels. And you can sort from there and see where do they live now, where do they work now. And so maybe you're really interested in working at Merck, for example, and you want to see what are the 12 Dornsife alumni who work there. You can click on that, it'll show you all the people, and then if you're connected to them, whether through 1 or 2 connections, you can generally send them a message, and that could be a helpful way to find an informational interview opportunity. Of course, if you're, excuse me, connections to these people, maybe they could connect you, introduce you via LinkedIn or via email to see if they're open to connecting with you. And so these are really helpful, conversations that can be had through the job search process. And then I'm gonna, just for the sake of time, not talk about professional organization or associations, because we talked about that at the APHA workshop that was held back last fall a little bit. But that's a good networking opportunity, and like I said, APHA has their own Career Mart website. And I can talk a little bit about timelines, etc., if people are interested in that. But I do want to leave time for questions. But what I do want to just, kind of review and recap is that there are lots of possibilities for opportunities. They don't have to be a 9-to-5 job if that's not something that you think would help you get to where you eventually want to go. Networking can be a way to learn about opportunities, as well as learning about how people progress in their career, not just how did they get that first job out of undergrad or a master's program, but how did they get to where they are today. And encourage you to reach out to folks and make those connections as you go on your journey. So I'll stop. I do have some info about timelines, if that would be helpful. I see some nods. Are people interested in timelines? Are there any other questions while I pull that up? All right. So I said earlier that fellowships often, they can be, their application processes can be 6 or so, maybe 9 months out. Sometimes they're in the fall for the summer. There are fellowships that do kind of look around January, February for July or August or September placements for fellowships. So if I would do the search of the ones that I showed here, but also your own searches and connections with folks who are knowledgeable about those things, and then bookmark them, keep a spreadsheet of when the applications may open. Often the fellowships have informational webinars ahead of time, so they might say, okay, our application's open January 12th, but we have a webinar on January 5th that you can learn about the application process so you can start to get your materials ready, for example. But for full-time jobs, I get a lot of questions about how long does it take? Or people say they're surprised about how long the job search takes. So of course the answer is it depends. It depends what sector you're looking at. It depends on the level of job potentially. It depends on, are they interviewing multiple positions at once or for multiple positions at once, and how urgently they need a person in that role. So like I said, it depends on the sectors and the time of year. So said that about fellowships. So years of service often have many opportunities, but they tend to operate on an academic sort of schedule. So they may start in January, June, and September when grads are graduating. And so about jobs, about full-time jobs. So one study found that on average, it takes about 43 days to, from start to finish, from the hitting the apply button to getting the job. I mean, this is for one job. So this is, if you were the candidate they selected, it can take 43 days. For healthcare jobs, it's a little bit longer. It's about 65 days. And for higher level jobs, so maybe that's supervisory positions, it's more like 76 days. So these are just things to keep in mind. So what does that mean? So you want to apply early into lots of opportunities. So some of you folks are graduating in March, some of you folks are graduating in June, depending on what program you're in. So, this is something to think about if you're thinking oh, I need that 65-day timeline or that 76, day timeline, and that's, the pie in the sky situation where you apply for one job and get that job, So think about the timeline where you need to be submitting those applications and networking and building those kind of relationships. Anticipate that you may experience rejection from some of those opportunities. So again, don't put all your eggs in one basket. But view application processes as practice as well as interviews because you can learn something each time. And so I encourage, there is going to be an interview workshop in 2 weeks. Yeah. So definitely there will be people who hire depth students, ILE students, full-time positions. I'm not sure if they've experienced hiring co-ops specifically, but they can speak to interview processes. And, of course, if you want to practice a mock interview, there may be folks, staff at Dornside, faculty, friends who can give you feedback on how you answer interview questions. And of course, the good news, because I'm not going to leave you with just being like, oh, the job search takes a long time. But unemployment is low, and that's an advantage of the job seeker, especially those coming out of a degree program who may have, really relevant, experience and really up-to-date knowledge of the field. And Drexel grads come with great experience. Of course, you need to highlight the skills that you've developed through your co-op, through your depth, through your ILE, all these things. But be sure to not only demonstrate how those skills can benefit the org in writing, but in your cover letter, but as well as in your interview. I have slides on here about applying to graduate school. We're not going to dive into that conversation as well, but if people are interested, if they're leaving an undergrad program and are interested in master's programs, people interested in applying to med school or PhD programs in the future, there's a little bit on that as well, but you'll have the slides too. So with that, I'll stop. And Michelle, are there any questions from folks online? Okay, cool. Any other last minute questions that people have before we break and you're free to go? Excellent. Well, thank you all for, I'll slide back to my contact information. I do have office hours Wednesdays from 10 to 11:30. I don't have them tomorrow, so they start next week. So you're welcome to stop by during that time or make an appointment with me at another time if you're interested. So thank you all for coming.
Thank you.
Yeah, do you have the